People with gum disease are more likely to suffer a stroke. The evidence continues to mount. It's almost irrational at this point to deny that poor oral health leads to a myriad of physical diseases. Which makes perfect sense since the majority of bacteria enters the body through the mouth, especially a mouth already weakened by gingivitis and other oral bacteria. Recent studies have shown that people with gum disease are twice as likely to suffer a stroke than those who have a healthy mouth. The University of South Carolina School of Medicine's findings make it clear that the higher the level of oral bacteria, the worse the risk. Meaning that the more severe the gum disease, the more likely that patient will become a stroke victim. City University of New York School of Medicine confirmed those findings and stated, "It's a fact that is a dose-effect relationship." In a previous study conducted in 2000, a relationship between poor oral health and stroke risk was also published. Dr. Maurizio Trevisan, dean of the university, said, "Unfortunately, the study does not prove the cause-effect because it is only an observational study." But there is considerable evidence that the level of inflammation in both gum disease and the hardening of the arteries may play a role. However, the question that still remains is, if gum disease is treated, will that prevent strokes and heart attacks? More than 6,500 healthy adults were studied and categorized on their level of gum disease over a 15-year period. Those participating were largely white, with 55% being female, with the average age in the early 60s. Over the period of study, over 275 participants suffered a stroke. Although adjustments were made for other factors, such as age, unrelated health issues, and race, those suffering a stroke were those with the greater level of gum disease. Dr. Trevisan would not go so far as to say one should floss in order to avoid strokes and heart disease. But given the evidence, it's clear you should take care of your mouth no matter what. 2 other studies found that those who make regular visits to their dentists have a lower risk of ischemic stroke than those who don't. When you consider the mounting evidence, it's clear that maintaining a healthy mouth is essential to maintaining a healthy body. And maintaining a healthy mouth is relatively easy. You need only brush your teeth twice a day, remove any trapped food particles, which are the root cause of gum disease, with an effective oral irrigator, such as the Oral Breeze, and eliminate any remaining bacteria with a fluoride mouthwash. As the saying goes, an ounce of prevention is worth a pound of cure.